meeting that's organised for Dublin Bay South. It isn't a political, there's no political party dominating this. It is the repeal movement that we have been working on the ground for the last few years, and we have been working quite tirelessly to create a meeting like this. So I'm delighted on a terrible night to see so many people. But we have a fantastic panel that are going to, we have some experts, well, we have all experts actually. Well, yeah, I'm going to hand you over to Eileen Flynn. I have to say there's two Flynns here, okay? So I'm going to get mixed up. So this is Eileen Flynn. Eileen Flynn has been a repeal activist. She's also a member of the travel movement, who has been fighting for equality for most of her life, or all of her life, and is continuing to fight for equality in this referendum. So I'll hand you over to Eileen. Okay, thanks.
Hi everyone, I am not just a traveller, I am a traveller woman. Body is no different than any other woman's body. Traveller women go through the same, if not more, levels of inequalities because of who we are. When we are going to the stands, the polls, to repeal the 8th in the 25th of May, before I go out and vote, I need to make sure that this referendum meets the needs of working class women, middle class women, traveller women, migrant women, women from ethnic minority groups, and for young women.
Tara Flynn. Okay, and we will look forward to hearing from you, Tara. Thank you.
Thanks very much for coming to the Flynn's for Repeal meeting. If your name isn't Flynn, please leave. I'm sorry, it's just not for you. Thanks very much for having me. I'm neither an expert like Dr. Boylan, nor am I a future president of Ireland like Eileen. So
you need 700,000 just before you could even.
We'll do a whip round. Basically, what I'd like to do is, I suppose I've been talking a bit about this for a while since I told my own story of having to travel. I was directly affected by the 8th Amendment. So I had a crisis pregnancy in 2006 and I had to go to the Netherlands. That's where I went. And people, say, oh, it's brave to tell that story, and it's, or whatever they'll say about it, or isn't that sad? But actually, I want to pick up on what Eileen said, and I think the reason we're all here, or those of us who are fighting for repeal, is because, not for people like me who could travel, who had a credit card, who could have time off work, who didn't have to get childcare, who could go. We're fighting for the people who can't go, who are either forced to continue pregnancies with which they can't cope, or who take matters into their own hands. Because, speaking as someone who has had a crisis pregnancy, when you're desperate, you'll do anything. And the fact is that in Ireland today, people are harming themselves. People are doing Victorian level things. They're, throwing themselves downstairs, things that we don't even want to think about. It sounds like a horror story. That's happening because we're not providing safe abortions here. When you're faced with that, it doesn't feel like a choice. We say pro-choice. It doesn't feel like a choice, even though it's something you need. You know you need it. You're going to get it somehow. So isn't it better to have it safe and to have it accessible, so that people aren't put at extra risk or stress at an already stressful time? It might be a really difficult decision. I know I weighed every single option up, but I was on my own. I wasn't employed at the time, and I wasn't ready to be a parent. I was also 37. I wasn't your stereotypical, young one. I'm way older now, so I'm probably a bit more stereotypical. The thing that some people who resist change are trying to get us to fear is already here. It's already here. People are already taking abortion pills, or travelling, or taking matters into their own hands. Or we are forcing them to continue pregnancies they can't cope with. I think very often when we see posters, or we're reminded that, people might not choose to continue a pregnancy because of disability. Because of a disability in the pregnancy, in the developing fetus. But the thing is, the majority of abortions happen before 12 weeks, before those scans are even possible. So while that is something for people to think about in terms of what they might do in their own pregnancy, it's not something that is really part of this discussion. What should be part of this discussion is people with disability who might need reproductive care. That's something we need to bring back into the centre. So if we're talking about disability, let's talk about people who can get pregnant, who might need this care, who might be unable to travel. And so they're not one of the lucky people like me. So everyone has strong feelings about this issue. I know I did, but I knew I didn't want to talk about it. I knew I didn't want to face it, and I knew nothing about abortion when I was faced with a crisis pregnancy. I didn't talk to my mum about it because I didn't know how she felt, because we'd never had that discussion. That's how dishonest a relationship we have with each other when we don't talk about this. I'm not saying we should talk about it all the time. I know some of us, especially if we've been campaigning, we're sick of talking about it. We can't wait till we can leave it back in private again. But the thing is, until we take it out and look at it and acknowledge that it's already here and that we need to honestly care for people, it won't go away. It's never going to go away. If we don't, we're here to repeal the 8th Amendment. If it isn't repealed, we're back onto the streets again the next day campaigning, because this isn't a thought experiment. This isn't something that is abstract. This is real. This is people's real lives. So people every single day are going to be taking matters into their own hands or finding a way to end a crisis pregnancy if they have one. Now, of course, we need to discuss all the options, and that's what good reproductive care is. It's having all the options, discussing it with your doctor, and finding out, making whatever is that difficult decision for you. But without repealing the 8th Amendment, we can have no change, no matter what your views on gestational limits and all those things, which are things that we personally need to know. It's worth examining for yourself. What are your limits? What are your ideas? But we can't apply those to somebody else. Like Eileen says, we're not walking in their shoes. This really is the referendum, the unselfish referendum. It's not about what I think or believe. Often in interviews, people will ask me, what do you believe? What do you think? And I'm going, I can tell you, but it's not going to illuminate this discussion, because this discussion is about, I don't know what she believes. I don't know what she needs. I don't know if she can cope. This is about putting it back into the hands of the people in crisis, in conjunction with their doctors. Yeah, not an expert. Yeah, not an expert. Yeah. So basically, my crash course in what happens when you have a crisis pregnancy happened when it happened to me. And I had taken a morning after pill. I was one of the responsible. I always had condoms in my wallet back when that was so shocking that muggers would hand your wallet back to you in disgust. Because women having sex was much worse than robbery. So that was me. I was so smug about it. I was like, well, that's not going to happen to me. It sounds terrible. And I mean, if it happened to a friend of mine, I would help her, but it's not going to happen to me. So it's going to be fun. So I won't even think about it. And that's a luxury position to be in. And boy, was that smug grin wiped off my face. I did 4 pregnancy tests because I didn't believe that I was pregnant, because I had taken a morning after pill so immediately, and it took my whole world away. Being pregnant against your will is an absolutely terrifying thing. You're trapped in your body, and then you feel trapped again by your country. And I just think it's time to set people free. So my question to people is not, what do you feel about abortion? Because that's something we should all know. Again, like I say, that's something we should examine for ourselves. What do I feel about abortion? It's handy, let me tell you, in case you're ever faced with a crisis pregnancy, to know how you feel, to have examined some of that stuff in advance. I hope it doesn't happen to any of you. And I hope that if it does, we have care for you here. The question is, are you for or against abortion? Because everyone has a different view on that. Everyone in this room has a different view on that. My husband and I have a different view on that. It isn't, are you for or against abortion? The question is, would you force someone to remain pregnant against their will? And if you would force them to remain pregnant against their will, how exactly would you enforce that? And what does that look like? And is that a country you want to live in? So thank you for listening.
I'm going to pass you over to Dr. Professor Peter Moylan. And he is the master, or probably the former master, of the National Maternity Hospital, which is Holles Street Hospital. So well done to Peter.
When I was master, we introduced women who wanted to have their tubes tied, in other words, wanted to be sterilised because they'd had enough children and maybe had some reason why they didn't want to take contraception, or just because that was their way, their choice of dealing with their reproduction. And we introduced it in Holles Street, but as we were introducing it as master, I was requested to attend the Archbishop's Palace So I went up and we sat across the table, the Archbishop and one of his auxiliary bishops and myself and the matron of the hospital at the time, Maeve Dwyer, a wonderful woman who felt the same as I did. And they told us that we couldn't be doing this because it wasn't medically indicated. So I kind of said, well look, me doctor, you bishop. That was kind of a summary of the discussion. Anyway, we kept going. So over the years then, you know, dealing with women on a daily basis and crisis pregnancies and so on, and it became apparent to me that we had a profoundly hypocritical situation in this country, particularly with the 8th Amendment and the subsequent amendments about travel and information. We have a situation in this country where our Constitution protects a woman to commit a criminal act, abortion, as long as it's not committed in this country. So you can get all the information you want, you can travel abroad, and you're protected in the Constitution for that. But if you do it here, you could end up with 14 years in jail. Mm-hmm. So it's just, it's profoundly hypocritical and just simply wrong. And the point has been made by several of my international colleagues that if you're against legal abortion, you are in effect for illegal abortion, because that's what happens. And if we in this country didn't have the escape valve of the UK and Europe, then we would have illegal abortion fairly extensively in this country, and we would have maternal death and a lot of maternal morbidity with serious infections and hysterectomies for infection and so on. And also I think the people who are anti-repeal need to be asked the question, would you be happy to arrest every woman who goes to the UK and has a termination on her return because she has committed a criminal act by virtue of travelling for a termination of pregnancy? So those people need to be asked, would you do that, and do you think that would be the right thing to do? And I think the answer to that would be fairly clear. I'll just go through a few of the sort of points that have come up during the debate more recently. One of them is the whole question of 12 weeks of pregnancy. And I think to set it in context, I should just describe to you the sort of natural history of the first 12 weeks of pregnancy, because it is a fragile time. And the further back you go in assessing a pregnancy from the time of conception, the higher the rate of spontaneous miscarriage. So if you go right back to before a woman has had her period, and say a few days after conception, the miscarriage rate is around about 50%. So about 50% of all embryos conceived will miscarry. And many women won't even know they've miscarried because they'll have a period. It may be a little bit heavier, or it may be normal. And then the further into pregnancy you get, the lower the rate of miscarriage. So that by the time a woman reaches 12 weeks pregnancy, which is timed from the first day of the last period, so it's an embryo of 10 weeks age, if you like, the likelihood of a miscarriage is very low beyond 12 weeks. So 12 weeks is a sort of a milestone in pregnancy. And before 12 weeks, the pregnancy is fairly fragile. It's not completely well established. And you can't be absolutely certain that it's going to go without problems. So this idea that every time a woman conceives that is going to be hunky-dory and we'll have a bouncing baby at the end of it, which is a sort of an impression that's given out by the anti-repealers. So it's important to understand that. The reason why 12 weeks has been chosen, I think, by the Citizens' Assembly and by the Oireachtas Committee is for that very reason, but also because of rape. And when a woman is raped and becomes pregnant, she can have a termination of pregnancy medically without undergoing any surgical procedure. She can have it medically in the comfort of her own environment, in her own community, in her own home, by taking the pills. And the pills have two effects. One of them blocks one of the hormones that sustains a pregnancy in the very early stages, and the other tablet makes the womb, the uterus, contract. And the woman experiences what would be like a spontaneous miscarriage. The earlier after conception those tablets are given, the more effective they are. But they are effective up until 12 weeks in the community. Beyond that, the same mechanism is used to terminate a pregnancy, but it has to be done in the hospital setting because it's more complicated. You need more tablets, there's more likely to be bleeding and other things, so the woman will need to have more medical help. But up until 12 weeks, and certainly up until 10 weeks from the first day of the last period, they are extremely effective and extremely safe. And the mortality rate in association with abortion is way lower than the mortality rate in association with pregnancy. So any argument about there will be maternal deaths and so on from introducing more liberal abortion legislation is just plain wrong. It's absolutely incorrect, factually incorrect. The other point about the 12 weeks that has come up or came up a while ago relates to the ability to diagnose disability as a consequence of chromosomal problems, and more specifically the Down syndrome babies were the ones that were chosen as the poster children, if you like, to say that if our legislation is changed, as suggested by the Oireachtas Committee, that we will end up with eliminating children with Down syndrome from our society. Iceland is often quoted, and how many births do you think there are a year in Iceland? Will somebody give an estimate? There are 70,000 births a year here, roughly.
10,000. 5,000.
There's between 4,000 and 5,000 births. So it's quite reasonable to expect that there will be no children born with Down syndrome in Iceland on occasions in a calendar year, not because of abortion, but because there were none conceived and survived to birth. So again, the manipulation of the facts is something that you need to be aware of. The other point is that they say that, well, 90% of children with Down syndrome are aborted in the UK. That's absolutely incorrect, because not all women will have the screening test, and not all women who choose to go ahead and have the complete diagnostic test on top of the screening test, if they find out that they've got a baby with Downs, not all of them will proceed to termination of pregnancy. It's also important to understand that not all Down syndrome children are the same, just as none of us are the same. A lot of children with Down syndrome have serious cardiac heart problems. A lot of them have serious brain problems, and a lot of them have serious bowel problems. And they can have very complex abnormalities. So they're not all happy children. A lot of them have very severe disability, way beyond just having Down syndrome. But when people choose, women and couples choose to continue on with a pregnancy, where there is a disability diagnosed, or where a serious abnormality is diagnosed, those women and those couples deserve and get in the Irish system the full panoply of healthcare. They're not shunned away, they're not put away somewhere. They attend for all the regular visits, and we have in this country this concept of the perinatal hospice, which has been in existence in this country for as long as I've been practicing here, which is many years. And again, the suggestion that this is some kind of new invented thing that will make it all happy-clappy is, again, incorrect and wrong. That approach, that compassionate approach, has been in existence in this country for an awful long time. With regard to the proposed legislation, which is where termination will be legalised for a threat to the woman's health, people have said, well, how serious does the threat have to be? And really the answer to that, if the woman thinks it's a serious threat, it's a serious threat to her life. And you can, just to take two examples, if you take a woman, say, who's 43, has had a whole series of IVF attempts and actually gets pregnant, but she also has diabetes and severe high blood pressure, and she's at quite serious risk of perhaps going blind or getting kidney failure during the course of a pregnancy, but she's willing to take that risk. On the other hand, you get a woman who is also 43, has 5 children at home, and gets pregnant unexpectedly, but also has diabetes and some high blood pressure. And she'd say, I don't want to take that risk. I've got 5 kids at home. So it's really important that if a woman feels that the risk to her is too much, then it is too much. And it's not up to the doctors to decide how severe a risk is, it's up to the woman to decide. And we have to get into a position where we've made reference to trusting women, and certainly that's absolutely the case. That's what we should be driving for. I'm almost finished. With regard to termination for fetal abnormalities, that is where the baby has a condition where it's unlikely to survive after birth, almost definitely not going to survive or unlikely to survive. A baby in the womb is in an intensive care unit, and it's as if it's on a ventilator, which it's getting oxygen through the placenta, through the afterbirth, through the umbilical cord, from the mother's bloodstream. So it's on a ventilator. It's also getting renal dialysis. It's on an artificial kidney machine, because the placenta also acts as removing waste products which are removed by the kidney after birth. And it's also getting intravenous nutrition, again through the umbilical cord from the mother. So a baby in the womb, in the uterus, is in an intensive care unit. And we, as adults and after birth, if somebody is in an intensive care unit and the outlook is hopeless, the family gather around, the doctors say, look, there's no chance of whoever surviving if we disconnect the machine. And they will accept that, and we all find it very acceptable that the machine should be disconnected, and nobody thinks that that's wrong. Most people think that that's a very humane way of dealing with the issue. In the same way, if a baby has a condition from which it will not survive outside the womb, is delivered, it will die. And it doesn't matter if it's born at 40 weeks, or 20 weeks, or 30 weeks. It will die from the condition. So again, it's up to the couple to decide when they would like that baby to be delivered. And if it's delivered before viability or before X weeks, it's regarded as a termination of pregnancy. Otherwise, it's regarded as a normal delivery, or delivery preterm, post, before the due date, after the due date, and so on. And I certainly have personal experience of a couple, with several experiences, a couple who had a baby with a fatal abnormality. We all knew the baby was going to die inevitably, and they decided that they would continue with the pregnancy, so that was fine, and they attended very regularly, and she was knitting little hats for the baby and little gloves and all the rest of it. And they came in, she went overdue, 42 weeks, 2 weeks overdue. She came in, we induced the labour, she had the birth, and the baby died, within a few minutes of birth. But they were very happy with that. The next pregnancy, she came along, and it looked like the same thing was happening. And she said, I can't face this again. I want to have a termination of pregnancy. So, people change their attitudes depending on their circumstances. And it should be the couple's choice, the woman's choice, not the legislator's choice. Another couple who requested the testing to see if they had a baby with Down syndrome or one of the other complicated chromosomal abnormalities. They said, we just want to get the testing because we just want to know and be prepared, because we're not those sort of people. And I said, that's fine, whatever. And we did the testing, and it turned out that the baby had a really serious problem, and then they were those sort of people. So again, personal experience changes attitudes. And they went and had a termination of pregnancy, and for them that was absolutely the right thing to do. So basically it comes back to what Tara and Eileen have been saying, really, is trust women, treat them as adults, and stop interfering in other people's lives. Countries which have liberal abortion laws are not uncivilized. We all like going to Paris, to France, to Rome. Scandinavia is regarded as one of the best, most civilized areas in the world, and they've all dealt with this issue. So I think it's about time that we grew up and respected other people's views. We have to respect other people's views. They don't have to get involved, and they can have conscientious objections in the hospitals and so on. But please don't stuff your ideas down the rest of our throats. So we have to answer questions.
This is really about winning the referendum to repeal the 8th Amendment. The reason why we need to win this is because although our citizen assembly came back with the clear facts that we should be repealing the 8th Amendment with the provision for the 12-week abortion pill, and their terminology is unrestricted, we just say just to provide the abortion pill. There is some discussion over the polls, and the polls don't look as clear as they should be. And if they're 42 or 48-52, what that will mean is it will leave us with less of a negotiation when it comes to whatever is the next step, okay? The next step being the legislation, okay? So we need to have a clear margin to win this. And we can do it, but we do need the groups out. So